Root canal is where you remove the nerves from the infected root. Now you have to understand the tooth anatomy to understand root canal. Tooth has 3 layers. दांत जितना आपको मुंह में दिखता है उतना दांत नहीं होता है. Tooth is a long entity. So tooth has a crown part which is seen in your mouth and a part which goes in the bone which is root. There is a channel from where the tooth gets blood and nerve supply. This space inside the tooth is called a canal, which is because in the root of the tooth it is called root canal. The treatment of root canal means removing that infected or painful nerve from the canal and filling it back with a shock absorbing artificial material. If the cavity is being delayed or neglected, the cavity goes into the deep part of the tooth which is called pulp, which is actually blood and nerve. Now when it is painful, we need to actually remove that. So that is when you need a root canal. There are many times because of the extreme heights away from the sea level or idiopathic pain in the tooth wherein your nerve in the canal has become hyperactive and you have pain sensation. Now these are the cases which will also need a root canal to calm down or to remove that pain from the tooth. The third is extreme sensitivity, which could be because of the tooth grinding away and the top layer of the nerve being exposed. Now every time you eat or drink, it causes extreme sensitivity, which is unbearable. This time we do an intentional root canal. If the tooth is fractured, then root canal cannot solve the pain. So those are the cases where we cannot do a root canal. If the tooth is completely broken into 2 parts and there are chances and the bone is very infected, we do not do a root canal. Root canal is not a time consuming treatment. Today, because of invent of better materials, root canals can be completed in one sitting. The only cases that require a root canal to be taken time are tooth which are infected and have a cyst behind or below their roots. If your teeth has very slight amount of pus, then root canals can be done in single sittings and win one appointment. So root canal now are not time consuming. Root canals definitely make your teeth brittle, but it is the best and the safest option to restore your tooth and get it fixed. So rather than removing a tooth, you can actually save the tooth into your mouth. So root canals are very safe procedures. If it is an intentional root canal and the cavity size is very small, we take a call that we do not need caps on the root canal. But if you have got cavity and the cavity is big and the tooth is very badly destructed, then we need to do filling as well as a cap on the root canal for its longevity. So a crown can be mandatory in many root canal cases. Root canals, you need to understand, is where your tooth nerve have been removed and you will not feel any pain in them. So say suppose if there is constant food lodgement around your caps after say 8 or 7 years of your root canal, it is mandatory to go and check that if you are getting any secondary caries, because you will not have pain. Third very important thing is that your root canal teeth are a little brittle. So do not have a lot of crunchy things, very, very hard things on it, so that its life is actually very more. So that is something that you should avoid. And to take care of your root canals, my suggestion is after a cap, use a water flosser so that the interproximal, जो दो दांतों के बीच की जगह है, that area is kept very clean and your crowns are clean and you do not get secondary cavities.